If you're watching this video, that means you've scheduled a consultation or you're interested in a procedure. I'm excited to tell you more about it. The goal of this video is to give you as much information as possible so that you can make the right decision for you. I want you to be comfortable and confident about this process. A tummy tuck is a transformational procedure where we remove loose skin, we tighten your abdominal muscles, and we also do liposuction to contour. So during the procedure, we make a low incision. It hides well underneath the underwear line. We elevate that skin up to about the level of the sternum. Then we tighten the ab muscles with good solid stitches. We then pull all the loose skin down and we remove it. So all that loose skin is gone. Your belly button, it's attached to a stalk. It stays in the same place. When we shift all that loose skin down, then we just cut a new hole and pop the belly button through. Typically it involves liposuction, 360, so we do it on the back and the front, and it really helps to contour and shape the waist. A good candidate for a tummy tuck is someone that's had children, and maybe they have some loose skin or their abdominal walls are stretched out. Also, it can be for someone who's lost a lot of weight and is left with a lot of loose skin. That can be women who've had children or lost weight, but it can also be for men who have lost a lot of weight as well. We do surgeries in an accredited surgery center. You'll be under general anesthetic and have an anesthesia provider. And it typically takes about 4.5 hours for the procedure. After surgery, you're able to go home. You'll have some drains and you'll have an abdominal binder. That night after surgery, I want you up and walking to decrease the risk of blood clots. And it's important to know that you might have some drainage, and often we put in a lot of numbing medication for the liposuction, so having some bloody drainage after surgery is normal, and that usually after about 24-48 hours that drainage stops. So I see you the next day, I make sure everything looks good, and then you're able to go home. Typically the recovery is about 2 to 3 weeks, and in plastic surgery this is kind of one of our bigger recoveries, so you're going to be a little bit sore, but you're going to be able to get through it and you're going to do awesome. The full restrictions is about 6 weeks. No heavy lifting, no strenuous exercise, no use of your core abdominal muscles, because we stitch those ab muscles and we want to protect that repair. After your drains are out, we transition you to a compression garment. And that's something that's kind of form-fitting and helps get rid of any swelling and really helps your result. And typically we want you to wear that for about 6 weeks. Some of the potential complications of a tummy tuck, while low, they can happen, so it's important we talk about them. It can be bleeding, can be infection, can be poor scars, it can be skin that dies, it can be a fluid collection like a seroma, or more worrisome would be like a blood clot. That's a DVT or a pulmonary embolus. So it's really important that you walk early and often after surgery. And also to help prevent blood clots, we send you home with compression devices on your legs, and that squeezes the legs to get the blood flowing. We also inject some long-acting numbing medication in your ab muscles during the procedure. And that helps you be less sore, so you're more likely to get up and move early after surgery. Hopefully this was helpful information. If you have questions about a tummy tuck, bring them to your consultation. We're happy to answer them for you. We look forward to seeing you.